Hi, my name's Matt. I'm a doctorate nurse practitioner student at UMass Amherst. I'm going to do your interview today. It's probably going to take about 20 to 30 minutes. Um, what do you like to be called?
Christy is fine.
Okay. Um, what brought you in here today?
So, I went to see my primary care doctor for an annual physical and was talking to her about some concerns I had, about some worrying and kind of just bothering me, thinking about things a lot. And she recommended me to come talk to somebody about it, and that maybe somebody could help me out.
Was there anything specific that you've been experiencing recently or was that just part of your regular physical?
No, that was part of my regular physical, but since I saw her last year, I kind of just expressed more that it was bothering me and I was thinking about things and that my thoughts were actually bothering other people. And my husband noticed that I was, preoccupied and just thinking about things.
Okay. So, what's changed recently? What has it been recently as opposed to like 6 months ago, 3 months ago? What's been going on? Any specific events you've had? Anything changed in your life particularly?
I don't think anything has been really life changing. It's more just stress and added, responsibilities. But I notice now more that I'm having a harder time managing it. Certainly being up, worried about it, not sleeping, and enough that my husband is concerned that I am just kind of dwelling on things and not myself.
Okay. When would you say that it became more acute? When did you notice it more? When did it change from being manageable to more feeling unmanageable?
It's kind of hard to define a time frame. I know, like, since as long as I can remember, I've always had anxiety. So I don't know what has prompted it to get to this level now. And that's, I think, what is another concern is why am I feeling more anxious?
So you can't point to any specific events, like some traumatic event or something happened with a family member. It's just kind of...
Not really. I mean, other than stress with life and school and balancing things, no, I feel that,
Yeah, what is going? Has anything changed in your life socially? Or you're working?
I'm working full time, and I'm also a student. So I think just trying to add those responsibilities and then home life with, family and children. And, I think it's a trying age with my kids because they're young. So maybe that could be something, but I don't think that would be kind of the one thing I could fixate on.
Can you think of a time in your recent past where you felt emotionally well, you felt really good and happy and less anxious?
That's really hard to. Again, it's hard for me to say. As long as I can remember, I've always had anxiety. But I think when I can disconnect a little bit, and if I'm, on a break from school or on vacation, is when I feel well.
Okay. So
Or at
maybe
my
when
best.
your outside situations are less hectic, you kind of feel less anxious.
Yeah.
So how would you describe your current level of functioning? Are you able to, what would you accomplish in a day? Is there anything that interferes?
Yeah, I think that just being so constantly preoccupied with things, I'm very on edge. Just kind of feel like I'm going to fall off the edge. There's never, an end to anything that my worries. So, again, the fatigue from not sleeping,
Okay.
and being up, being worried, these symptoms. I mean, maybe I could say it's been a year since I saw my primary care, so 8 months would be like an accurate
Okay.
kind of guess as to how long this has been going on, and I don't know why it's bothering me more now than it has.
So you can't put your finger on one specific reason. It's not like this makes me more anxious than that. It's just like a general feeling of it.
Yeah, I think yeah. I mean, really, it's a lot more roles and responsibilities that have come up, but not one specific monumental event. It's not like somebody died or there was a huge transition. So,
What about physical symptoms? Have you felt any? You ever feel like your heart palpitating, skipping a beat, sweating, excessive tremors, or anything like that? Feeling of fullness in your throat?
Definitely fatigue and definitely sweating. I do notice when I'm in a large group of people or like presenting information, I get very nervous, and maybe it doesn't reflect, but I think internally, tremors, and again, the sweating is big, and not so much of like pain or anything like that, but just general like kind of nausea type thing.
Would you say in your life, though, like you talk about addressing a crowd, being in front of people, is that a theme? Has that always been that way, or do you think that it's more increased now?
It's always been that way, but it's definitely not getting better.
Okay.
And usually people say when you do it more, it gets better, and I don't see that. And maybe that's making me more anxious.
Does your current employment role, does it require you to address groups of people?
Yes.
Or? Okay. So it seems to be a little tough for these times. What about like panic attacks? Have you ever had any, really any numbness or tingling in your limbs, or where you actually had to step out of a room or get out of the situation because you were fearful or of losing control? Have you had that happen?
No, I can't. I mean, maybe there were panic attacks, but I was able to kind of get through them with just doing the typical breathing and just resetting for a second, but nothing to the severity that I had to like remove myself.
Okay. What about worrying? Has there been any excessive worrying? I think did you mention restlessness or sleeplessness? How has your sleep been?
Not well.
Not good?
I've been tossing and turning at night, and I try to talk to my husband about these worries, but again, if there's not one thing I can pinpoint, it's hard to explain to somebody why you're just generally worried and anxious.
Do you find it's difficult to get to sleep or to stay asleep?
Difficult to get to sleep.
Okay.
Usually
and when you're asleep, do you find yourself waking, or?
On occasion. Not always. Sometimes I will wake up. That actually happened today. I woke up earlier than I usually do, and I couldn't get back to sleep. And typically that's not a pattern for me. So.
Okay. How about during the day? Do you get excessive fatigue, difficulty concentrating, excessive irritability, anything like that?
Absolutely, definitely difficulty concentrating, and the fatigue I think is playing a huge role. I'm noticing more towards the mid-afternoon, dinner time. I'm very tired.
Okay.
So.
What about like muscle tension and things like that? Do you find yourself tensing up your neck?
Mm-hmm.
Headaches?
A lot of headaches.
A lot of headaches. Okay.
A lot of headaches and migraines lately, and I'm trying to kind of approach that from many different angles.
Okay. So we've talked about when the symptoms might have begun, and you mentioned something about 8 months ago, but there's no particular precipitating event. There was no traumatic event in your life. Mm-hmm. Have you sought any treatment for this before?
I have, on and off, and I think it was more or less as a stigma for me to not, if I was put into therapy or on medication, I would do it for a period of time and then stop, because I just feel like I could overcome it and not want to be labeled as having anxiety or anything like that. So it's been an ongoing thing.
Was there ever, can you think back at a period in your life where you felt like, wow, I really feel good. This is the best I've felt.
That's really hard to say because it's been so long that I just feel like I've been stuck in this kind of cycle. Maybe when I didn't have as many responsibilities, and I think that's just part of life and growing up. So,
have you ever been hospitalized for any reason?
No.
Are you receiving any outpatient mental health treatment?
I was seeing a psychiatrist to try to manage some medication pieces because a lot of people were mentioning that there was a lot of like complementary modality treatments, St. John's wort and things like that, and I kind of felt like I was getting really confused and what was the right path, so I did seek treatment from a psychiatrist to help.
Okay. Are you taking any meds right now for mental illness? Any antidepressants? Or?
I'm taking Prozac.
Okay. How long have you been taking that?
Maybe about 6 months.
Who's prescribing? Is it your primary or?
The psychiatrist, because the primary care doctor initially was prescribing it, and she's the one who kind of felt like now that things were not really getting better, but not getting worse, I needed to seek.
And how are you doing with the medication? Has the dose changed? How much? You said you were going to say 20?
Yep.
20 milligrams once a day?
Mm-hmm.
Okay. And you haven't had to adjust the dose up or down?
Not right now. I don't know if I'm just so immune that I'm just being kind of cautious about making changes, and I thought maybe this could be a first step before I make a medication change.
You haven't had, so do you feel like the medication has helped you? Have you noticed, did you notice an improvement in the beginning and maybe diminishing, or how did that?
I think that that's accurate because I was on Zoloft for a long period of time, and the thought was that I had increased dosage and things weren't getting better, so we decided to switch to another SSRI medication, and
Okay.
they put me on this one, and it's kind of a low dose, and I'm not really sure at this point where to go with it.
So you were on the Zoloft first, and you stopped the Zoloft, you transitioned to the Prozac because the Zoloft didn't
And
feel
actually,
like it was
I
effective?
forgot to mention I went on Wellbutrin in the middle of that too.
Okay. Any negative side effects from any of the medications?
Wellbutrin was really bad for me.
It was, okay.
I had profuse sweating, and the anxiety got worse.
Okay, okay. Was that the same provider for all of these?
Yes.
Okay, good. So right now, 20 milligrams a day. Are you on any other medications?
Nope. Just some omeprazole for like reflux, but
Okay. No medications for anxiety, any over-the-counter medications for sleep?
melatonin,
Okay.
5 milligrams, I think it is.
But no specific anxiety medications or...
Nope. Other than just that the Prozac, I'm not taking anything specific for like anxiety.
Okay. Do you have any history of violence towards others, violence to animals, violence to yourself, any self-harm?
No.
Any thoughts of self-harm, and you're not having any thoughts of hurting yourself now?
Mm-mm.
No thoughts of suicide?
Nope.
Okay. So right now, how is your mood? I know we talked about the anxious feelings, the physical manifestations of that. What about feeling depressed, feeling sad, feeling blue?
I don't feel depressed. No, not at all. I don't feel, like hurting myself or hurting anybody else. I don't feel depressed. So that's what's, I think, interesting, and I don't really understand.
Do you get activities that give you pleasure or happiness? Say with your children, activities, do they still give you pleasure, or is it doesn't feel like it's difficult to enjoy yourself?
No, I think, definitely being around my kids and disconnecting from the things that I can identify as being stressors in my life do make me feel happy.
Have you ever had any visions or heard voices that things that weren't there, something that only you heard?
No.
Okay. What about social situations? Like if you're out in public or you're in a crowd of people you know or people you don't know, are you able to handle? Or if you walked into a room, crowded people that you didn't know, not that you had to speak, but if you walked into the room, how would you feel? Do you get anxious about those situations, or are you comfortable?
No, I get anxious. I even get anxious in an environment where I know people.
You do.
Yeah.
So even people you know and people you don't know.
Very perceptive about what their thought is of me when I walk in the room, regardless of what it's for.
So you feel like you're the subject, you're the object of attention, even though probably most likely you're not.
Right.
You kind of have thoughts of that. So what about obsessions or compulsions? Is there anything that you feel like you need to do? I need to do this, or I need to check this. I need to make sure that this is turned off. Did I turn the oven off? Did I turn the iron off? I need to wash my hands. Is there anything that you feel that you're compulsed to do that, gets in the way of your day?
No, I think it's just this kind of never-ending getting my things done and having that to-do list, which is kind of always rolling. Sometimes I notice that I will be doing one thing, and then say I'll be getting the kids ready for school, and then I'm upstairs putting away laundry, and that preoccupies me for 15-20 minutes when I could be probably doing something else. So I just kind of feel sometimes like my thoughts are really unorganized and all over the place. Okay. But other than that, I don't feel like I'm obsessive or compulsive, like I have to check the door or wash my hands or anything like that.
Okay. What about any trauma in your history of trauma? And I know these are sometimes difficult or sensitive questions. Has there been any history of abuse or physical trauma, sexual trauma?
No not so much like physical trauma. I mean, maybe some emotional trauma in the past, many years ago. But other than that, I mean, nothing that it was really to a point where I needed to seek attention for that.
So your relationship now, you're married now,
Mm-hmm.
so it's not something. It's a healthy relationship for you. You're not fearful or
No, I mean, I think it just upsets me that my husband is really upset and concerned about me being so preoccupied and being so anxious.
okay. Do you ever get concerned about your health, like your physical health, like something's wrong with me? There's always something wrong with me. I feel like something terrible is going to happen to me, or I feel sick, or I'm going to die, or any thoughts like that?
Not really. I mean, sometimes I get a little concerned about um, the fact that I have a couple different things going on with like migraines and stomach things, but I don't think I preoccupy with those. I think I just attribute it to something and try to seek or try to get it to get better, and that's it.
What about body issues? Any preoccupation with body weight or what I eat and how I look, how I feel? I don't, exercise. Do you get any exercise or activity?
Try to, and I think that that's the kind of challenging part is with trying to balance everything. Adding in an exercise component is just one extra thing on my to-do list. So I wish I could just figure out how that could all work into my health and my lifestyle. I certainly, love to lose some weight and eat better.
But you don't feel it's not something that's on your mind all the time. Like I need to feel this, or I need to feel that, or I need to lose weight, or what is your eating pattern? I mean, how would you say if you went through the day? How many times a day would you eat?
That's where it kind of varies, and I think a lot of how I feel plays into that. And when I'm anxious, my stomach tends to kind of flare up, so I may not eat a meal. I'll just kind of grab things and go, and it's not always the healthiest of things. I think that but typically it's not uncommon, like where I'll eat breakfast, skip lunch, and then eat dinner and try to grab something in between.
What about nausea? Do you get excessive nausea? Do you feel from being anxious or?
Yeah, and I had that a lot when I was a child with school. I noticed I would always complain of stomach aches, so it would get me to the nurse's office to get me to go home.
Okay.
And I think that's where a lot of the beginning, plus the headaches, might have stemmed from. And I do still get a little nauseous, like when I'm worked up.
Okay. What about substances? Do you drink alcohol?
Very, very minimally. I find it more or less irritates me than anything as far as my gastric stuff.
Okay. What about any drugs? Any legal drugs or illegal drugs? No abuse of over-the-counter medications or anything like that? And you said you only take the melatonin for sleep.
Mm-hmm.
Okay. What about we covered the bases on the mental health history. Is there any significant medical history?
Not really. I mean, I have 2 children. They were healthy, and they are healthy, and I've only been hospitalized like once or twice. Once for some pneumonia, and the other was for tonsils. But other than that, no.
Okay. And so you're not on. You mentioned Prilosec?
Yeah, for reflux.
Okay.
And they've kind of just said that is.
Are there any over-the-counter medications that you take for your you call them migraines, for your headaches, or?
I'm seeking therapy for that right now, and right now I'm just on more of a when I get the headache, I take something, not so much a preventative medication. So that's something I'm working with my neurologist.
Okay, so you have a provider for specifically for the migraines.
Yeah.
Okay, but you don't have a provider for GI issues.
I do. I don't see him. Mostly my primary care is managing that because it's just more of a omeprazole, and she's fine with writing that. She said.
Have you ever? To backtrack a minute. Your psychiatric, your Prozac. That you've never had those medications prescribed in the primary care environment, only by a mental health provider?
No, I did have them prescribed by a primary care provider, but they were mostly like a short term. Like I had it after I had my first and second child, because there was some question about some postpartum I might have been experiencing.
Okay.
But really and honestly, I ended up being fine, and it was just my children were colicky, so I was just having a hard time managing them. But so they didn't really have a problem with prescribing it. However, they did recommend that they only knew certain types of drugs, and it would be better to seek somebody else who had more knowledge in that.
And you're keeping your appointments with your psychiatrist that prescribes them and
Yeah,
monitors?
every 3 months.
Okay, good. And he's careful about listening and adjusting the doses or changing the medications, and nothing has made you, you would never stop taking them on your own.
Right.
You cannot stop, psychiatric medications suddenly on your own. Are you allergic to any medications?
No.
What about family history of mental health issues or substance abuse? Anything?
So I have an aunt on my dad's side. My dad has 3 sisters, and one of them suffers from severe depression and anxiety. She was hospitalized twice in a mental health facility. And I also have a cousin who's also on my dad's side. It was a first cousin who committed suicide.
Oh, okay. How long ago was that?
About 7 years ago.
Okay.
And she was 32.
Oh, wow. Okay. How did the family cope with that? Were they able to, was it cause a lot of trauma? A lot of...
It's been very challenging.
Continues?
I think it does. I think, she left behind a daughter, so we're trying to, work through that and be there for her as a support. But as a family, I think, it's just definitely a gap and a void that is very challenging to fill.
Are both your parents alive?
They are.
And siblings? Do you have siblings?
I have one brother.
Okay. Do you have a good relationship with your parents?
I do. Yeah, they're very supportive.
Okay. What would you say, how have you been described as a child? When you were a child, did people have any description of you? She was this, she was that, she was always fun-loving, she liked to play, she got along with others? I mean, how would you say if you, we have all heard people like to describe how we were as kids.
Mm-hmm.
I mean, we all do. I think we've all heard that from our parents and our family members. They like to tell other people what we were like as children.
Absolutely.
So how would you say that you would have been described as a child?
I think I was pretty creative. I could have been sometimes mischievous, but I was very curious. I think, I like to kind of, my attention span kind of, drifted all over the place. I like to do a lot of different things. I definitely like to be active outside and doing things. So I think those are just a few things that from what in memories that I can recall.
What about academic performance in school? Did you ever have any problems? I mean, were there any, how were your grades like going through school generally?
I always was a fairly good student. There were points in time where I had challenging classes and courses, but I always maintained everything was a C or greater.
Okay.
For an average, so.
You never had to take any medications for an attention deficit or anything like that?
No.
Okay. And so academically, we talked about your grades. So right now, so you said you're working full-time, and you're also a student. Okay. Any legal history at all? Have you ever been arrested?
No. Fortunately, I mean, I try to do my best and try to, obey the rules and the laws, but.
Okay. How would you say your relationship is? How long have you been married?
It'll be 10 years this year that we've been married.
Okay. And would you classify that, happily married? Or, I mean, I know you've had some additional stress lately, but you've been,
Yeah, I mean, I think, we do our best to work out our problems. I mean, communication is a challenge, but I think, see eye to eye, and we understand that, we're trying to make it work.
Communication's a challenge. Like, you just, how would you describe that?
I think I kind of shut down, or when I'm talking to him, like, he expressed that he's so concerned about me coming to him and burdening him with my worries, that he, there's no problem that we can pinpoint any of this to. And so he doesn't have ways to help me. I think he's willing to listen to me, but he's just kind of helping me acknowledge that I needed to talk to somebody.
Is there somebody in your personal life, or a friend, a close friend, Is there somebody that you would confide in for when you're feeling excessive emotions or nervous or anxious? Is there somebody you can rely on? Somebody you can pick up the phone and call?
Yeah, and I
Or
think there's a lot of somebody's. I think I'm really good about not, I don't have a good poker face. I tell people kind of how I feel. So I think it could be a good quality because that way people, I can connect with people on different levels. But I do have friends that I could, talk to about
Okay.
more personal things.
So you're not afraid. You don't feel like it's difficult to express yourself. What about when you're with a psychiatrist? Do you feel like you hold things in, or is it difficult to tell him how you're really feeling? Or
Not really. I mean, I think I pretty much tell them what it is I need to get across, and I think it's just the uncertainty of not knowing why it is that what I'm worrying about. People usually have concerns about their health because they are diagnosed with an illness, or a problem in their marriage because their husband or wife is gambling or drinking, and I can't identify problems like that, and so I think that worries me because people are suffering other things that are worse. I could have a child with disabilities, and I don't. So I want to see the better in things, and being preoccupied and worried, it's not getting me anywhere. It's starting to impact things for me.
okay. And you did say that this came out of this was your primary care doc. He's the one that referred you?
Yeah.
Okay. Okay. I think we've covered a lot of topics.
I think one thing I forgot to mention too, when we talk about like certain situations that might have made this worse. I do have my only brother, my only sibling, recently just came out and mentioned that he was gay, and that has been a process for us. But I think I'm at a point where I accept it and I'm getting better. However, I have family members that don't, and so that has just been a little bit of a problem. But other than that,
has it caused a break in the family, separation of people, or people taking sides?
it's now getting better. I think my mom is having a really hard time dealing with it because she doesn't, she has her own beliefs and values, but she hasn't disconnected from him and she's still speaking to him. So I think it's just progress, and I think it's just going to take time. But I mean, that's the only thing I can think of that maybe that's underlying for me that's causing some extra added.
How long ago would you say he admitted that he was gay?
About 6 months ago. It was like in July or August of this last year.
Okay, so
when I talk about the 8-month timeline, maybe.
Yeah, that's what I mean. Was that maybe a precipitating event that caused a lot of stress in the family and caused added stress for you? When did you become a student again?
That also happened around the same time. In the spring.
Have you ever involved yourself in any stress reduction programs, or mindfulness, or meditation, or yoga?
Trying to be better about that. Again, it's kind of like the exercise thing where I'd like to figure out a way where I can balance it in my life, and I don't have to focus on like going to the gym 3 times a week. To me, that's just another appointment that I would have to keep. So those are all things that I am interested in figuring out.
Okay. Well, maybe you can consider, I think we'll probably would like to meet with you again, because I think we're probably, it doesn't sound like you've had many, I think you're dealing with anxiety, generalized anxiety. It doesn't sound like you've had immobilizing panic attacks that have shut you down socially, or that you've had to get away from people. I think maybe generalized anxiety. So maybe we could talk about some techniques to deal with that, some mindfulness approaches, things that you can do at home, or you don't have to go to a structured environment. The things for stress reduction. Let's, if you're open to it, we can meet again and try to find ways to not reduce the stress in your life, because that is there, but find ways where you can process it better and maybe become a little more at peace in your own head. Look for some natural remedies. And get you on a healthier track, or get you feeling better. Do you have any follow-up? Any questions?
I don't think so. I think it's in addition to the medication that I'm on with the psychiatrist, I think hopefully this will be a good compliment, and maybe I just have to put myself in the right mindset. I think that's it, and be open.
Well, it sounds like you are. You're here. You have a provider that you see, you follow up with. So it sounds like you're pretty proactive with your treatment, and you're doing the right thing. So if you'd like to, if you're open to it, we'll meet again and we'll talk more specifically about the anxiety and things that we can do to improve it.
I'd like that. I think that's a great
All
idea.
right. Thank you very much.
Thank you so much.